I'm Dr. Paul Dale. I am the Chief of Surgical Oncology at Alice Fischel, and I specialize in the surgical treatment of melanoma. The most common type nationwide is squamous cell carcinoma. It's so common that we don't even report it because there's millions of cases of squamous cell. And then there's basal cells, and they're very similar. They often don't spread. They're very locally advanced, and they can be kind of nasty. They're treated often in dermatology offices. And the third kind is the more serious one, the more scary one, the more deadly one, and that's melanoma. Squamous cells and the basal cells are either treated with a medication, actually can put a medication on them, make them go away if they're not really deep or really bad, or surgery and remove them. Sometimes even radiation can be used to melt them away if they're big and large. Versus melanoma, which always is basically surgically removed with wide margins to make sure that it doesn't come back. And additionally, you also have to treat the melanoma because of its potential for spread. You have to find out in most patients whether or not it has spread to the lymph nodes, and we do a special biopsy oftentimes, and it's called a sentinel node biopsy, which is just taking out one lymph node to find out whether or not that tumor has spread. Not for every patient, but for those that have deep melanomas, then you have to find out whether or not it's spread or not. And that's the most prognostic factor that's associated with melanoma is how deep is it? How deep has it spread from the surface of the skin through the levels of skin? There's 5 levels, so which level has it gone down to? The deeper the spread, the higher the risk of metastatic melanoma. If you go read about melanoma, they talk about the A, B, C's, D's, and E's of melanoma. Asymmetrical moles, moles that don't look round. They look irregular. Borders, the borders are the irregular borders. C is the color. If a mole starts to change color, if it goes from red to brown, brown to red, white to dark, dark to white, then diameter is not so important as it used to be, but we thought that if it's bigger than a pencil eraser, then you should have it checked out. And I think the most important thing is evolution, meaning that if a mole is changing, and if you're worried about it, have your doctor have it looked at. In fact, there's been some recent studies that concern about a mole is one of the highest risk factors for it being a melanoma. Early detection for melanoma is the key. You need to be aware that moles can change, and if they do change, have it looked at. Early detection, you're gonna live a good long life.